Is cancer the cause of your tailbone pain? That's the topic for this video. I'm Dr. Patrick Foy. I'm an MD or medical doctor, and I'm the director of the Coccyx Pain Center or Tailbone Pain Center here in the United States. I'm online at www.tailbonedoctor.com. And this is the next in a series of videos that I'm doing. I'm basically going chapter by chapter through my book, Tailbone Pain Relief Now. Chapter 13 in the book is cancer causing tailbone pain. And the reason why this is an important chapter is that often this is something that is overlooked or something that is not considered by many treating physicians and by many patients as well. I've treated a couple thousand patients with tailbone pain or coccyx pain, and unfortunately a number of them have had cancers in the area. Certainly not the majority of patients, but a small enough minority of patients that it's worth keeping this diagnosis or consideration in mind. So in chapter 13 of the book, I basically start by giving a story of one such patient who had been suffering with tailbone pain for a while. Was not receiving an accurate diagnosis, did not have an accurate explanation for what was causing their pain, and eventually came here to the Coccyx Pain Center or Tailbone Pain Center, and workup here revealed that the patient did in fact have a malignancy that was eating away at the coccyx or tailbone and also at the lower sacrum as well. In some cases, these may not show up on typical x-rays, so additional studies may need to be done. The chapter here goes through a lot of that. The main take-home message really is that it's important if somebody has tailbone pain that's not getting better with standard typical treatment, or that there's not a clear explanation for why they're having the tailbone pain in the first place, from whatever initial tests are done, it's important to keep cancer in mind. Some of the things that are also gone into in further detail within this chapter in the book are discussions about chordoma. Chordoma is a particular type of cancer, a particular malignancy that is called a primary bone tumor, meaning that it starts within the bone itself. Other cancers may spread to the bone from other areas, but chordoma starts within the bone, and it has a tendency to occur at the sacrum and coccyx area. In patients that have chordoma, unfortunately it is a highly fatal cancer. Most people who have a chordoma, unfortunately, do not survive the cancer. It has a tendency to occur in this area. It's a nasty cancer in terms of its fatality rate. The other things that I would say about chordoma are that initially it can be missed by plain x-rays. I've seen a case where the x-rays looked totally fine, and only by MRI or CT scan was the chordoma apparent. At least initially it can be missed by x-rays. Later on it certainly can become more obvious. Other things about chordoma, it's treated in a number of ways, including surgically removing a large area of the body, including the entire coccyx, often much or all of the sacrum, some of the tissue in front of the sacrum and coccyx, including the rectum. So then people have a colostomy bag essentially coming from the stomach, where the stool or feces comes out because they've lost their rectum as part of the surgery to treat chordoma. So it's just a terrible and unfortunate malignancy. Something that I keep in mind when I'm evaluating patients for tailbone pain. There are other. The chapter goes into other types of cancers in the coccyx region. The tailbone is very close to the rectum, so you have to keep in mind rectal cancers, which are unfortunately common. There are also other pelvic cancers. In males, you think about prostate cancer, which can spread throughout the pelvis, including spreading to the coccyx region, and can cause coccyx pain. For female patients, you think about gynecologic cancers, such as cancer of the ovaries or the uterus or the cervix, so cervical cancer. Any of those can cause spread to the tailbone area and then pain in the tailbone area, and sometimes that may be the initial presenting symptom for those cancers. There are also other types of masses and tumors that are not truly malignant, that are not truly cancerous, but that occur in the tailbone region. There's one in particular that occurs just behind the rectum and in front of the sacrum and coccyx. It happens to be called a retrorectal hemartoma, and I've seen patients with that as well that will report this pressure in the tailbone area, and the diagnostic workup may reveal that the x-rays look totally normal at the sacrum and coccyx, but workup reveals that they have actually a mass, a soft tissue mass, not a bony mass in this case, located in between the rectum and the sacrum and coccyx, so behind the rectum. So the term that's used for that is retrorectal, meaning behind the rectum. That's typically not cancerous, but it has a potential to become cancerous over time. That needs to be taken into consideration, and often a decision needs to be made about taking a biopsy, to take a piece of that tissue to evaluate it in the hospital pathology lab and determine whether or not it is cancer already or not, and the consideration as to whether to surgically remove it. The book chapter goes into a lot more details about the different types of cancers that occur in the tailbone area. Some of the symptoms that would have me more concerned about cancer would be a patient who had symptoms like unexplained weight loss. If you've lost 30 pounds in the last handful of months without trying to do so and don't have an explanation for that, cancer would be one possible explanation. And if you have pain in a specific body region, such as at the tailbone, along with that, then you'd be thinking, well, maybe that's where the cancer is located, if that's actually the cause. Other symptoms would be things like pain at night. Other symptoms would be if you have let's say unexplained rectal bleeding, unexplained vaginal bleeding. If you have a family history or a personal history yourself of having pain within the pelvic area, so if you have a history of rectal or anal cancer, or if you have a history of prostate or ovarian or cervical or uterine cancers, then even if those have been treated in the past, the concern would be whether this is a return or a recurrence of those same cancers again, and this time perhaps either causing referred pain to the tailbone or actually having spread to the bones of the coccyx or tailbone. So those would be some of the types of symptoms to think about. Other things are that and workup would depend upon the symptoms and would depend upon the specific patient. So workup could include things like a colonoscopy or seeing your gynecologist, or other types of tests that can be done depending on what cancer is suspected. The imaging studies become very, very important when you're evaluating for whether a patient does or does not have cancer. As I mentioned, the x-rays are often a starting point, and the x-rays certainly sometimes can reveal an abnormality, but the x-rays are not the most reliable test when it comes to evaluating for malignancy, and often we need to look at getting an MRI or a CT scan, or in some cases even a bone scan. So there's a number of studies that are done. As we'll get into in one of the later chapters about some of the tests that are done for tailbone pain, a big problem is that the testing for tailbone anatomy often is not done properly in most medical centers. The tests that are done routinely for an MRI of the pelvis usually does not include adequate visualization of the tailbone or coccyx. And then MRIs that are done of the lumbar spine are too high up, and they don't include adequate visualization of the coccyx if it shows the coccyx at all. So it's very, very important that the ordering physician writes for the orders in a very specific way so that the tests are done properly in order to show the tailbone and to show whether there is or is not any cancer or malignancy at the tailbone itself, or in the soft tissue structures in front of or nearby to the tailbone. So that's about the imaging studies. Other tests that sometimes are done, if you're worried about rectal cancer, you can think about having a colonoscopy and things along those lines. Again, it depends upon what is being suspected or ruled in or ruled out. Other things are that the treatment really varies depending on the cancer. I mentioned that there's very aggressive treatment for chordoma, but the other cancers, it really depends upon the malignancy. Often it depends on what's shown from the biopsy or the imaging studies and how certain it is that it's actually a cancer in the first place. If it's a cancer that's aggressive, such as chordoma, typically the answer is to have that surgically removed, to maximize the chances of the patient surviving before it becomes more widespread. So in general, if you have tailbone pain that doesn't have an explanation for what's causing the pain, certainly if you have a history of other pelvic cancers, either in yourself or an immediate family member genetically, then you want to think about having the appropriate workup to evaluate for that and to make sure that the tests are done properly, because unfortunately the majority of the time when MRI and CT scans are done, they do not properly show the tailbone. So just information to keep in mind, information to discuss with your local treating physicians. If you're interested in more information from that book chapter or any of the other chapters in the book on tailbone pain relief now, the best way to get the book is to go to the website www.tailbonebook.com, and it will give you the links to the Amazon pages and other places where you can get the book either in a paperback copy or in the electronic copy or ebook copy, which you can get any place worldwide that has internet access. It's a couple of dollars, so maybe worthwhile if this is something that that you're suffering with. If you're interested in coming to see me or find more information that I have online, the easiest way to find me is to go to my website, which is www.tailbonedoctor.com. So I hope that information is helpful, and post your comments or questions down below the video if you have questions about malignancies or cancers at the coccyx or the coccyx region. Okay, bye-bye now.